Let's talk about epilepsy syndromes. Benign Rolandic epilepsy. Age of onset, childhood. Seizure types, simple. What's partial mean to you? How much of the brain? Focal, involving mouth and face. Could be also generalized tonic-clonic. What does that mean to you? The entire brain. And how is your patient going to present? All four extremities, extended, and then clonic jerking movements. Associated findings, nocturnal preponderance of seizures. Nocturnal, at night. EEG finding, we have temporal spikes or central temporal spikes. Treatment, frequently no treatment is needed as seizures are nocturnal and self-limited. Maybe perhaps you're thinking about a sodium channel blocker known as carbamazepine. We'll get into treatment further, but at this point, benign Rolandic epilepsy, luckily, most of the time, with this being a nocturnal issue, self-limited in nature. Contratemporal spikes is the clinical pro. Here, it's called Lennox-Gastaut syndrome. Interesting enough, there's been this huge push, well, not just push, but let's just say cannabis has taken on quite a bit of media attention, hasn't it? CNN, all of these, and you know about Dr. Gupta and his studies and his investigations on children that have had particular epileptic issues such as Lennox-Gastaut syndrome. Let's begin. Age of onset, childhood, early adolescence. I'm going to be very deliberate here because this condition is no joke. Seizure type, tonic, clonic, myoclonic, generalized, all over the place, All over the place. What else? Mental retardation, association. EEG findings, I need you to know this, slow, 1 to 2 hertz, paroxysmal fast activity, multifocal spikes. Now, what you need to know at this point for management is not going to be cannabis. That is not going to be an answer. Please don't choose that. Anyhow, the point is, we know that marijuana and cannabis has been receiving quite a bit of attention because in certain types of epilepsies, especially in children, in which the occurrence of such seizures are so severe that maybe, perhaps, marijuana has a place. But as far as you're concerned right now, on your boards and wards, in current clinical practice, this is what you need to know. Almost all require AED type of workup. Now we'll get into the drug soon enough. We have valproic acid or valproate, lamotrigine, fulminate are most broad spectrum type of drugs that you're thinking about with a particular childhood epileptic syndrome known as Lennox-Gastaut syndrome. You've heard of Charlotte's Web. Here we have absence epilepsy, and this is this epilepsy or seizure that I had demonstrated at the beginning of our topic. Once again, childhood and adolescence would be most common. Absence meaning to say that you have these blank stares that may last for seconds. Associated findings, hyperventilation could be a trigger, but usually you'll have these children that will grow out of these seizures with time. Thank goodness. I'll get into the treatment soon enough. You must know for absence, here we have 3 hertz spike in wave. Clinical pearl, 3 hertz for absence epilepsy. The drug of choice is going to be ethosuximide. Sure, valproate could be here too, but your focus should be in ethosuximide. And I'll tell you right now, focus on letter T, please, and ethosuximide. And those of you that are well-versed with your anti-epileptic drugs, you know exactly why I'm having you focus on that. I'm just giving you an introduction. Let's talk about juvenile myoclonic epilepsy. Adolescents, as the name implies, young adult. Myoclonic, what's that mean? Absence. Could be generalized tonic-clonic as well. In terms of your jerky movements, you must know the associated findings. Here we have early morning preponderance, please. Clinical pearl, early morning, young adult, no doubt, juvenile myoclonic. Triggers include sleep deprivation and perhaps alcohol. Here we have 4 to 6 hertz. Treatment here would be valproate, maybe lamotrigine, and topiramate. Usually here the medication is required, however, for lifelong. With juvenile myoclonic, unfortunately, many of your patients are not going to outgrow the issue. Whereas in absence, luckily many of your children, in fact, will outgrow the issue. Let's move on to adult epilepsy. Most adult onset epilepsy causes are partial onset seizures. What's partial mean, please? Focal. How much of the brain? Good. One portion. How many different types of partials did we look at? Or did you look at? You looked at the simple, and you looked at the complex. With the complex, you could have automatisms. Before we move on, tell me about the consciousness, the description. You have loss and impairment. For focal, you're focusing upon impairment. Lack of impairment, simple. Impairment of consciousness, complex, and automatisms. Most common cause, idiopathic. Understand what particular part of the brain is most susceptible to a focal type of seizure. It's the medial temporal lobe. Medial temporal lobe. And that's a clinical pearl here. Tumors are much more common cause in adults than would be in children. That's an important point. In the elderly, stroke, by far, 70% of your cause of adult epilepsy in the elderly would be stroke. Cerebral vascular accident. Could be trauma, could be tumor. Metabolic disturbances, what does that mean to you? You have maybe liver disease or perhaps kidney disease are frequent causes. Electrolyte issues such as hypomagnesemia, once again. Urinary tract infection, perhaps. Medication related. And from maybe benzo withdrawal. That's a big point. If you withdraw from benzo, perhaps your patient may present with epilepsy.